Legislative audit on the state's COVID-19 turnaround times show there are no specific guidelines for labs to follow.
The auditor spoke with ABC4 News investigator Jason Nguyen about that and why the state needs a time frame to complete COVID-19 tests.
Legislators wanted to know how long it takes labs to process Utah's COVID-19 tests.
We do look at that in the report, and we do feel that, the two big issues are, public health and then almost, economic liabilities that could occur if those results are not turned around in a timely manner.
4 investigators from the Office of the Legislative Auditor General found 2 common scenarios kept playing out.
In some cases, they were defining that at the time between a patient getting swabbed until the lab turns out the result. And in some cases, it could have been the time the patient was being swabbed to when the provider contacts the patient.
Investigators identified one process involving the tests. The patient gets swabbed, the test is sent to the lab sends the results to the provider, and then the results are given to the patient. In most cases, the auditor says the results were back in less than 2 days.
We just found incidences where it did take a number of days to get those results.
I asked if that was problematic for Utahns.
That's a great question, and absolutely.
The audit states the Utah Department of Health should post the processing times by lab and geographic location.
They have that data. They can do that pretty quickly.
In response, the Utah Department of Health states it will work with the legislature to determine what elements of the reporting would be most helpful to be publicly posted. State officials say they welcome the findings in the audit and will work on implementing them. I'm Jason Nguyen, ABC4 News.